Welcome to Nursing and Biology. Today you are going to listen about Addison's disease. It is a chronic primary adrenocortical insufficiency. Addison's disease is caused by a deficiency of cortical hormones. It results when the adrenal cortex function is inadequate to meet the patient's need for cortical hormones. Autoimmune or idiopathic atrophy of the adrenal glands is responsible for 80% of cases. Other causes include surgical removal of both adrenal glands or infection, tuberculosis or histoplasmosis of the adrenal glands, inadequate secretion of adrenocorticotropic hormone ACTH adrenocorticotropic hormone from the primary pituitary gland results in adrenal insufficiency. I will repeat, inadequate secretion of adrenocorticotropic hormone from the primary pituitary gland results in the adrenal insufficiency. Symptoms may also result from sudden cessation of exogenous adrenocortical hormonal therapy. Clinical manifestations or signs and symptoms of Addison's disease are: the chief clinical manifestations include muscular weakness, anorexia, gastrointestinal symptoms, fatigue, emaciation, dark pigmentation of the skin and mucous membranes, hypotension, low blood glucose, low serum sodium, and high serum potassium. Mental changes are seen: depression, emotional lability, apathy, and confusion are present in 60 to 80% of patients. In severe cases, disturbance of sodium and potassium may be marked by depletion of sodium and water and severe chronic dehydration. What is Addisonian crisis? This medical emergency develops as the disease progresses. Cyanosis, fever, and classical signs of shock, pallor, apprehension, rapid and weak pulse, rapid respirations, and low blood pressure. Complaints of headache, nausea, abdominal pain, diarrhea, signs of confusion, and restlessness. Slight overexertion, exposure to cold, and acute infections decrease salt intake and may lead to circulatory collapse, shock, and death. Stress of surgery or dehydration from preparation for diagnostic tests or surgery may precipitate Addisonian or hypotensive crisis. Diagnostic evaluation. Definitive diagnosis is confirmed by low levels of adrenocortical hormones in blood or urine, decreased serum cortisol levels. Medical management. Immediate treatment is directed toward combating shock. Restore blood circulation, administer fluids, monitor vital signs, and place patient in a recumbent position with legs elevated. Administer intravenous hydrocortisone followed by 5% dextrose in normal saline. Vasopressor amines may be required if hypotension persists. Antibiotics may be prescribed for infection. Oral intake may be initiated as soon as tolerated. If the adrenal gland does not regain function, lifelong replacement of corticosteroids and mineralocorticosteroids is required. Dietary intake should be supplemented with salt during times of gastrointestinal losses of fluids through vomiting and diarrhea. Nursing management of Addison's disease. Assessment. Focus on fluid imbalance and stress. Check blood pressure from a lying to standing position. Check pulse rate. Assess skin color and turgor. Assess history of weight changes, muscle weakness, and fatigue. Ask patient and family members about onset of illness or increased stress that may have precipitated crisis. Major nursing diagnoses include fluid volume deficit related to inadequate fluid intake and to fluid loss secondary to inadequate adrenal hormone secretion. Knowledge deficit about the need for hormone replacement and dietary modification. Collaborative problems or potential complications are Addisonian crisis. Planning and goals. Goals may include improving fluid balance, improving response to activity, decreasing stress, increasing knowledge about the need for hormone replacement and dietary modifications, and ensuring absence of complications. Nursing interventions are restoring fluid balance, record weight changes daily, assess skin turgor and mucous membranes, instruct patient to report increased thirst, Monitor lying, sitting, and standing blood pressures frequently. Assist the patient in selecting and encourage the patient to consume food and fluids that assist in restoring and maintaining fluid and electrolyte balance. Example: foods high in sodium during gastrointestinal disturbances and very hot weather. Include a dietitian for added guidance. Assist patient and family in learning to administer hormone replacement and to modify dosage during illness and stressful occasions. Provide patient with written and verbal instructions about mineral, corticosteroid and glucocorticoid therapy. Improving activity tolerance. Take precautions to avoid unnecessary activities and stress that might precipitate a hypotensive episode. Detect signs of infection or presence of stressors that may have triggered the crisis. Provide a quiet, non-stressful environment during acute crisis. All activities are carried out for the patients. Explain all procedures to reduce fear and anxiety. Explain the rationale for minimizing stress during acute crisis. Monitoring and managing complications of Addisonian crisis. Assess for signs and symptoms of crisis, circulatory collapse, and shock. Avoid physical and psychological stress, including exposure to cold, overexertion, infection, and emotional distress. Initiate immediate treatment with intravenous fluid, glucose, and electrolytes, especially sodium, corticosteroid supplements, and vasopressors. Avoid patient exertion, anticipate and take measures to meet patients' needs. Monitor symptoms, vital signs, weight, and fluid and electrolyte balance to evaluate patients' progress to pre-crisis state. Identify factors that led to crisis episode. Now, promoting home and community-based care. Teaching patients self-care. Give patient and family members explicit verbal and written instructions about the rationale for replacement therapy and proper dosage. Teach the patient and family how to modify the drug dosage and increase salt in times of illness, very hot weather, and stressful situations. Instruct patient to modify diet and fluid intake to maintain fluid and electrolyte balance. Provide the patient and family with a syringe and vial of injectable steroid solution Solucoref. Injectable steroid name Solucoref for emergency use and instruct when and how to use. Advise patient to inform healthcare providers, example dentists, of receiving steroids and wear a medical alert bracelet. Teach patient and family the signs of excessive or insufficient hormone replacement. Instruct patient regarding modification of diet, sodium for illness and hot weather to maintain fluid and electrolyte balance. Continuing care. Encourage patients to weigh themselves daily and detect significant changes in weight that indicate fluid loss due to too much hormone or retention due to too little hormone. If the patient is unable to return to work and family responsibilities after hospital discharge, refers to home health care nurse. Assess recovery, monitor hormone replacement, and assess stress in the home. Assess patients, plan for follow-up visits to the clinic or a physician's office. This was about Addison's disease or Addisonian crisis. This audio is for educational purpose only. Thank you for joining this educational stream.